Hi everyone, I'm Katie, and today I'm going to be talking about Alzheimer's disease. This is just a general outline of what I'm going to be going over today. So what is Alzheimer's? It is a degenerative disease that affects the memory of individuals. It's the leading cause for dementia, and it accounts for 60 to 80% of dementia cases. Due to the severity of the disease, it's the sixth leading cause of death in the United States. And on average, after a diagnosis, people only really last for another 4 to 8 years after their diagnosis. Who does it affect? It's been found in humans with the earliest case in 1906. And while it's not officially named Alzheimer's in animals, primates and certain strains of mice can develop symptoms really similar to Alzheimer's. Risk factors associated with the disease include age, family history, gender, race and ethnicity, and a couple more on the next slide. But it's most common in those 65 and older. However, this isn't a normal part of the aging process. With family history, if you have a parent or sibling diagnosed, you're at a higher risk, and the risk increases if you have more than one relative diagnosed. It affects women more than men, and Black people are 2 times more likely than white people to get the disease, and Latinos are 1.5 times more likely to develop the disease than white people. There are certain genes associated with the disease, both with the late onset and early onset. However, just because you have the disease, the gene, it doesn't mean you're going to get the disease. With Down syndrome, if you already have Down syndrome, you're more likely to develop the disease, and you do so 10 to 12 years earlier than others. And if you already have head trauma or mild memory and thinking issues, you're also at a higher risk. So the disease is primarily caused by a buildup of amyloid beta plaques and neurofibrillary tangles. Amyloid beta is a byproduct of APP processing. During APP processing, there's 2 paths that can go depending on the enzymes used to carry out the process. A non-amyloidogenic pathway and an amyloidogenic pathway. Amyloid beta is produced during the amyloidogenic pathway. Neurofibrillary tangles are deposits of misfolded and hyperphosphorylated tau protein fibrils in the cytoplasm. And these changes can lead to the common behavioral and cognitive changes we see in people with the disease. Symptoms and early warning signs. So with the late onset variety, symptoms can start appearing in their mid-60s. And with the early onset variety, which is much less common than the late onset, symptoms first appear in patients aged 30 to 60. However, Alzheimer's starts damaging your brain a decade or more before you start showing memory and cognitive problems. And we kind of divide Alzheimer's into different stages depending on the severity of the disease and the symptoms you're experiencing. So in the preclinical stage, this is where you're not showing any symptoms, but damage is already occurring to the brain. In the mild early stage, where you're frequently diagnosed at, you start seeing memory loss, poor judgment, loss of spontaneity, you're repeating questions, you're wandering and getting lost, and you have increased anxiety and aggression. In the moderate stage, you have increased memory loss and confusion, a short attention span, hallucinations, and the list continues. With the severe late stage, these people are completely dependent on others for their care. They're not really able to communicate with us very well. They have severe weight loss due to trouble swallowing. They're sleeping more, and they may have seizures, and they may become bowel and bladder incontinent. For treatment options, there's no cure, but there are treatments available to mitigate the symptoms and slow the progression of the disease. Multiple drugs are available to treat the symptoms of Alzheimer's. Some common ones that I found were cholinesterase inhibitors that work to inhibit the breakdown of acetylcholine, which is believed to be important for memory and thinking. However, as Alzheimer's progresses, there's less and less acetylcholine, so these drugs aren't going to be able to help long-term. And N-methyl D-aspartate antagonists work best to treat moderate to severe stages by regulating glutamate in the brain. And these 2 drugs can be taken simultaneously. Most medication works best in people who are currently in the early or middle stages, though. In addition to this, to help slow down the disease, you can also try exercising and eating a Mediterranean diet really to help you. And then that is all.